most people, if they said what's most important to you as far as your health or what's your most important sense, would say vision. There have been many studies done looking at what do people fear most as far as their health. I think number one is usually cancer, and number two is blindness.
My name is Belgrad. When I was 7 years old, I was diagnosed with a rare corneal disease. However, I was fortunate enough to be sent to the best corneal specialist, Dr. Anthony Aldavi. Over the years, I developed a special relationship with Dr. Aldavi, learning that he takes numerous trips to impoverished countries to teach and perform difficult eye surgery. So when he offered to have me on his trip to Vietnam, I of course responded with an enthusiastic yes. And I also decided to document his selfless work abroad.
My name is Tony Aldavi. I am an ophthalmologist at the Jules Stein Institute, University of California, Los Angeles. I have been at UCLA now for 15 years. The ability to see is the ability to be engaged in this world. So blindness, let's say, in a developing country often takes two people out of the workforce. The person who's blind and then the person who has to take care of them. With my organization, Visionaries International, as well as with partner organizations such as SightLife, I travel outside the United States on skills transfer courses about 6 times a year, about once every 2 months. Vietnam is one of the countries to which I've been more than 3 or 4 times. In the developing world, the incidence of corneal blindness is much higher than in the developed world. So worldwide, 90% of the corneal blindness is in the developing world. Countries like Vietnam, where infection is by far the most common cause of loss of vision from corneal disease.
Dạ vâng, thì cháu bị vôi ném vào đi chơi tối thế nào.
Trong quá trình đi học cấp 3 thì trong quá trình nghỉ hè thì em có đi làm thêm và
The number one limitation is lack of available corneal tissue. Pretty much every country in the world outside of a handful of countries, of which US is one. There's not a set of eye banks in most countries that can recover tissue and distribute them to surgeons in need.
Even some doctors, they think that the patient cannot be treated with the cornea transplantation because it's not available in Vietnam, because we have a very few donors.
So the trip that we're about to go on to Vietnam, we'll go to 2 different eye hospitals, the 2 biggest eye hospitals in the country, the Ho Chi Minh City Eye Hospital in Saigon and the Vietnam National Institute of Ophthalmology in Hanoi. Ho Chi Minh City Eye Hospital, we will be operating with the surgeons there who are on faculty. Many of them we've worked with before. I'll be accompanied by Dr. Roberto Pineda, who's a corneal specialist at Harvard, as well as one of our cornea fellows, David Trong, who actually is from Vietnamese ancestry and is fluent in Vietnamese, so he'll be very big help. Our same group will then move to Hanoi. We'll be operating with Dr. Dong and his colleagues at VNIO, where we've been before, and training there as we will in Saigon, about 4 or 5 different doctors. The first day begins by screening patients who have been selected for surgery. Patients are presented to me either in the form of an Excel spreadsheet or their information is uploaded to a website. We use something called CyberSight, which is an organization's telemedicine program. So I have an idea as to how many patients, what type of diseases they have, and then I select the patients that we're going to see. Usually we'll see about roughly 50 patients on that screening day. After patient selection the first day, then we'll typically have lectures scheduled for the second day. And I hope also that when we leave, that you'll be able to be more comfortable performing these techniques for your patients so that we can improve outcomes for patients here at this outstanding hospital.
When he gives the presentation, he makes the difficult thing, complicated thing, become simple thing. So the audience is easy to understand.
The third day we'll have live surgery where I and the other surgeons who are part of the teaching faculty will perform the surgeries with the trainees either in the operating room or in a adjacent auditorium viewing it on a screen. In many hospitals we've seen just a lack of supplies, equipment, basic instruments that you would need to do corneal transplant surgery. I mean, our model of our organization is train the trainers. So when I'm in the operating room, I'm almost always with surgeons who I'm training from that hospital. Sometimes they come from distant hospitals to learn these surgeries. We saw a good number of patients who had had the surgeries of the type that we have trained the doctors there to perform, which was very encouraging. And I'm hoping that they will continue to be able to incorporate the surgeries we teach them as we do new types of corneal transplantation. My expectation is they will continue to incorporate those into their armamentarium and offer those surgeries for their patients.
Cô không có ngại một cái thứ gì cả, mà mắt bác sáng hay là coi như là bác không có ngại ngùng một cái gì hết. Và bác mừng lắm.
Tất cả mọi thứ đều thay đổi. Về công việc, về cuộc sống và về tương lai sau này.
Dạ có thấy rồi ạ. Nhìn thấy các bác các chị đây là sướng quá ạ.
So what's most important to me about traveling outside the United States and helping teach other doctors to perform corneal transplant surgery is the potential magnitude of the impact of what I do. When I go back to location and see somebody's vision restored by somebody who I've trained, that's even more satisfying, because I recognize that that has a much greater potential impact. Because if I've trained 10 people, and some of them may have trained another 10 people each, then we're talking about a huge potential impact, which is much greater than what I could myself ever achieve alone.